everything about a person was taken into consideration and not just the signs and the symptoms of the disease. So for instance, if three different patients walk into my office and the three of them have migraines, I may choose to treat the three separate differently. And because it has to do with the person that walks into my office with that illness, not necessarily the condition. So it's the holistic approach, is taking the physical along with the mental, emotional aspect of the individual into account before coming up with a treatment protocol. To find out what is actually the root cause that we just talked about, it takes time and patience. So the first visit is 90 minutes long. And that allows me to really understand what the symptoms are, what the signs are, and to really go in depth in terms of taking a very thorough health history. But at the same time, it allows my patients to tell me who really they are, so I can understand their lifestyle or what choices they're making that's possibly contributing to their illness. So that takes time. The modalities of naturopathic care are physical medicine, clinical nutrition, some energetic modalities such as homeopathic medicine and traditional Chinese medicine. That includes acupuncture. Acupuncture is actually one of the modalities that I use quite a bit in my practice, and that has been proven very significantly to reduce pain or even alleviate pain completely. So when it comes to pain management, I do use it. I use acupuncture, whether it's for migraines or it could be for back pain or tennis elbow. But I also use it for other reasons that may not include pain, such as insomnia, anxiety, depression, and the list really goes on and on. I also believe very strongly in continuing education, both for myself as a practitioner and for my patients. So for myself, I keep up with the latest research, and I also am connected with the cutting-edge laboratories that do various testing, such as hair mineral testing for nutritional means and also for heavy metal toxicity. And I also focus on hormonal testing, salivary hormone testing. So that's what I bring to the table in order to provide the best care for my patients. So one of the reasons that I hold frequent talks for the public is because I believe knowledge is power, and having the right kind of information empowers you to take charge of your health and well-being. Unfortunately, right now with access to the internet and have so many information put out there and not knowing where it's coming from, I think it's very important to get your information from a professional, and that's why for me having regular talks is very important. Naturopathic medicine could be an alternative medicine, or it could be very complementary. So there is no need to stop seeing your current family physician in order to see a naturopathic doctor. And really this is a teamwork. In my practice, I work with my patients. It's always a give and take. I give my suggestions based on the feedback that I get from my patients. So it's a very collaborative work.